The collaborative care model is an evidence-based approach that includes behavioral health care management and psychiatric consultation in a primary care setting. It's usually used for mild to moderate depression and anxiety and ADHD. It includes a registry, brief behavioral health interventions, medication monitoring, and treatment to target. North Carolina AHEC provides educational training and practice support services to healthcare providers across the state. Our mission is to recruit, train, and retain a workforce for a healthy North Carolina. In the collaborative care model, North Carolina AHEC has a team of coaches across all 9 regional AHECs who can provide support to primary care practices who are interested in integrating the collaborative care model. Our coaches can support workflow, billing and coding, and provide resources for additional collaborative care training. As a licensed clinical social worker and a practice support consultant with North Carolina AHEC, I've had the opportunity to see the benefit of collaborative care firsthand. I recently worked with a practice who had a patient who was receiving collaborative care who was a mom with 2 young kids. She already had a really busy schedule. She works 2 jobs. She runs her kids around town, and she needed behavioral health support. She shared that she was very appreciative that she was able to receive the care that she needed in a primary care setting that she already knew and trusted. She really appreciated that she didn't have to schedule an additional appointment and figure out transportation, and that she also didn't have to undergo the stigma of receiving behavioral health services from a provider in the community. Through a partnership with North Carolina Medicaid, North Carolina AHEC is working with primary care practices across the state who are interested in integrating the collaborative care model into their practices. North Carolina AHEC is also working with Community Care of North Carolina to offer a state-of-the-art registry to primary care practices who are engaged in collaborative care at no cost to the practice. The practice will need to be working with North Carolina AHEC coaching, as well as have all components of the collaborative care model in place in order to receive the registry. North Carolina AHEC is also working alongside several professional associations who are supporting the collaborative care efforts across the state. For additional information about collaborative care and North Carolina AHEC practice support, contact us at practicesupport@ncahec.net. Please stay tuned for additional testimonials from North Carolina AHEC practice support coaches on the value of collaborative care.
Collaborative care is important to me because I come from a social work background. And within the social work background, in my line of expertise and years of working, I've seen a lot of gaps in care and a lack of resources within the community. So patients are not able to get the quality care that they need because of these barriers and access to the immediate needs of their situations. So collaborative care could definitely improve that quality and to really target those barriers that the community is seeing at this certain time. Just for instance, being able to go to a medical practice and get treated for behavioral health needs, whereas they would be waiting on a list for at least a year. I think that collaborative care will definitely open the doors for that opportunity and really reduce these issues that we're seeing, and we'll be able to see a different outcome in patient quality and also more happier patients.
I think a lot of agencies ask, how and why is collaborative care good for my agency? And the point is that it keeps the patient outside of the referral system. They don't have to contact other agencies, they don't have to fill out paperwork, they don't go on a waiting list, and they don't have to tell their story over and over again. They can stay at their medical home and get the services they need for both their primary care and for their behavioral health. And at the end of the day, that's probably what we all would like access to.
have a practice that I've worked with that is going into their 3rd year with collaborative care. And I would like to say that one of the really exciting positives that have come out of it is around access, not just for the patient, but also for the provider on their schedules to meet the needs of their total patient population. What was typically in our region for the patients was a 6 to 9 month wait once a referral was given for these mild to moderate conditions that CoCM covers. And now, sometimes at the visit with the physician, a warm handoff can immediately be done with the behavioral care manager, if not the same week. And the patients going into remission time is weeks, not months, and they are improving before they would have even had their first appointment in the old methodology with the 6 to 9 month referrals. And then the other positive is the providers' schedules are being opened up so that they have more opportunity to see their other patients that have different acute problems and need the preventative care, and to help spot those patients that need to come into collaborative care. So I think it's a win-win for the practice and the patients, and access is being improved. And when access is improved, our patients get better.
The most rewarding part of being a practice support coach and helping practices implement CoCM is when I see the PCP have the aha moment that this program, which is evidence-based, can really help them help their patients. So they realize that they don't have the required time to make the most impact that their patients need. So they see the model as an additional resource that gives them tools, gives them additional team members to help them really impact their patients' lives and their well-being. So they understand that the behavioral health care manager helps give the dedicated time to the patient that is needed to make the biggest difference. They value the psychiatric consultant and the input and the suggestions and recommendations that they receive from that professional that generally is very hard to get in touch with. So the whole program is very impactful to the PCP in what they're trying to do with their patients. And that makes it very rewarding from my perspective to see that success and be able to provide a service to the PCP to help them create this service and make a big difference in their patients' lives.
Primary care providers, internal medicine and pediatricians have so much to cover in a 15 or 20-minute visit. When you think about this statistic of about 75% of the time a mild or moderate need for behavioral health comes up during that visit, it's really hard to cover it all. So what is the answer to this? I believe it's collaborative care. I'm so excited our governor has allocated over $1 billion towards this in our state. North Carolinians will be healthier overall. One of his top strategies to do this is integration of behavioral health into primary care. So how exciting this is that we can not only help the families, the patients that need this, but also the healthcare providers by sending coaches in to support you through this process. So what is collaborative care to me? It is the future of North Carolinians. It is the best yet to come.